Hello, Dazzle. Thanks for coming and hanging out with me today. I'm glad that you're here. Today, I'm going to be talking about a serious issue affecting healthcare workers and patient alike: nursing burnout. It's a topic we hear about more and more, especially after the challenges of recent years. But what exactly is nursing burnout and how does it impact patient care? So let's get into it. Nursing burnout is a state of emotional, mental, and physical exhaustion that nurses experience due to prolonged exposure to work related stress. It's not just feeling tired after a long shift, it's a deeper, more chronic form of fatigue that makes it difficult for nurses to perform their job duties effectively. According to research, burnout includes three key aspects: emotional exhaustion, which is the state of being physically and emotionally exhausted by work stress, characterized by low energy, fatigue, depression, hopelessness, and helplessness. Depersonalization, the interpersonal aspect of burnout that manifests in unfeeling, negative behaviors towards others, and the detachment from caring and instructions. And then the last piece is low personal accomplishment. And this is the state of negatively evaluating oneself as being incompetent, unsuccessful, and being inadequate. And consequently, people then exhibit low levels of contribution to work. Several factors contribute to nursing burnout, with workplace stress being at the very top of that list. Nurses often work long shifts, sometimes extending beyond 12 hours, and deal with high patient loads, particularly in understaffed hospitals. The demands of the job include not only physical labor, but also emotional strain, as nurses frequently witness suffering, death, and difficult family interactions. Additionally, the lack of support from management or the healthcare system as a whole can intensify this burnout. Nurses may feel that they don't have the resources that they need to care for patients properly. And with the added pressure of administrative tasks and documentation, the workload can become overwhelming. Work life balance is another issue. Many nurses struggle to find time to recover from their shifts and spend time with loved ones, and this leads to emotional exhaustion. Recognizing the signs of burnout is crucial for early intervention, and some of those common symptoms, including chronic fatigue, depersonalization, and reduced personal accomplishment, means that nurses are going to be experiencing burnout by being detached from their work and their patients. And this can lead to a decline in empathy and compassion. And these qualities are essential for providing good nursing care. So, those symptoms can include issues like headaches, sleep disturbance, or gastrointestinal problems. And they can also include mental symptoms like increased irritability, depression, and anxiety. And these can make it difficult for nurses to maintain their usual level of care. The most significant concern with nursing burnout is how it affects patient care. Burnout nurses are less likely to engage with patients fully, which can lead to medical errors, reduced attention to detail, and a lack of proper follow through. And this isn't due to negligence, but rather a result of exhaustion and emotional withdrawal. When nurses are emotionally detached, patients may feel neglected or uncared for, leading to a poor overall experience. In some cases, the quality of care may decline as nurses struggle to manage their workload or miss critical signs of patient deterioration. In severe cases, burnout has been linked to higher patient mortality rates in hospital settings. So, as one study noted, the present study demonstrates work conditions in terms of hospital type, census rate, and rotating shift as significant predictors of the patient's reported quality of nursing care. Nursing burnout doesn't just affect individual nurses and their patient, it has a ripple effect on the entire healthcare system. Burnout leads to higher turnover rates among nursing staff, which means hospitals and clinics face constant staffing shortages. As experienced nurses leave the profession, the burden on the remaining staff increases, creating a cycle of burnout. This turnover also has a financial impact, as hiring and training new nurses is expensive and time consuming. Healthcare facilities often have to rely on temporary staffing or travel nurses to fill gaps, which can lead to inconsistencies in patient care and increased costs. Moreover, burnout reduces the overall efficiency of healthcare system as nurses become less productive and the quality of care declines. Addressing nursing burnout requires a multifaceted approach. First, healthcare organizations need to focus on adequate staffing to ensure that nurses aren't overburdened with too many patients. Implementing reasonable shift lengths and ensuring that nurses have time for breaks during their shifts can really help reduce the stress levels. Mental health support is another essential component. Providing access to counseling, stress management programs, and mental health days can make a significant difference in preventing burnout. It is also important for hospitals to foster a supportive work environment where nurses feel valued and can seek help when needed. Encouraging a better work life balance is key, offering flexible schedules, more vacation time, and ensuring that nurses can disconnect from work when off duty can help them recharge and reduce the likelihood of burnout. Nursing burnout is a serious issue that affects not only the nurses themselves, but also the patients that they care for and the healthcare system at large. By addressing the root causes, such as staffing shortages, work life imbalance, and emotional exhaustion, we can help protect our nurses and ensure that patients receive the care that they deserve. Well, that's about it for my rambling today. Thanks for coming and spending some time with me. If you like my rambling, then click on that like button. It really does help. And until we talk again, you guys be sure to take care of yourselves. Bye.